y'all. Welcome back to another episode of Chats from the Blog Cabin. The show where I virtually invite people into the blog cabin to chat about life. And today we're chatting with Jenny. Now, I love her bio, and I'm just going to read it to you because she wrote it in my little one of the booking links. Says, I'm a mom who loves nice things and values health, wellness, and self-care. Starting a business and maintaining a healthy budget, both personally and professionally, are all important to me. And I think you and I are on the same wavelength there, because that is so me too as well.
Yeah, absolutely. And hopefully we can help some others who are struggling in that same area.
Yeah. So welcome to the show, Jenny. Tell us a little bit more about yourself.
Sure. Yeah. So I run a business really aimed at helping young families thrive. And so I got to that through being a physical therapist, working with children in their homes, and found that, as a PT, I was so focused on movement. But when you take a step back, you realize when mom isn't thriving and the household just isn't in a good rhythm, that nothing is thriving. And so I've carried that over into my own life as well, and appreciated my own health. And, self-care and all of those things are so important in making my own family successful and making me feel my best.
So where did you have the aha moment that you need to treat the whole family, not just one part?
Ooh, it was probably a series of small ahas that really added up, of those families who had just been in crisis, kids that were in the NICU for a long time, or parents that were separated and, just struggling with relationships and their own purposes in life, and realizing it didn't matter how great my interventions were. It didn't matter how hard we worked to get that child healthy. There was no success in that. And then I kind of, unfortunately, went through my own struggles a few years ago and was able to kind of put that lens on it. And I'm probably really good at hiding in my professional self, which was to my benefit at that point, to be able to step back and say, okay, well, these are the problems that are affecting you and your ability to thrive. And so I think it was probably a series of aha moments that have really gotten me to where I am today.
So what are some of the classic problems that are for parents and kids face that are with the inability to thrive?
Yeah, so coming from my place working in early intervention, we work with a lot of families where children have a diagnosis or a disability, or spent a long time in the NICU. Maybe they were premature. So a lot of those medical conditions can certainly play a role in that. But then mental health is such a component as well. And I think people underestimate the importance of grieving that process, grieving the birth you didn't expect to have, or that tumultuous time in the NICU. And then obviously from there, there's a hundred other things, but those are some of the examples I see on a day-to-day basis. And then unfortunately, just the society we live in, right? The stress we have, the unhealthy behaviors we have, the constantly being attached to technology. And I think COVID has slowed us down a little bit on a positive note, but at the same time, just that expectation that we're always on and always available. It's unhealthy on so many levels.
Now, you mentioned the NICU, and I had a thought in my head, and the mental health. Why is mental health not placed in importance? A lot of doctors don't place importance on mental health.
Yeah, so one of the things I actually get to do as well is teach a mental health first aid class. And I've been really amazed by the amount of people that just haven't had access to the care, haven't known the right questions to ask. I mean, I just think physicians get a few hours of that in school, right? When really it's probably half of our health. And I read a statistic just the other day that said something like 70% of primary care visits are related to anxiety and depression and other mental health related issues, even if that's not what they come in saying, right? And so I think there's just an underappreciation of how important it is, and also a lack of training for the medical professionals in general.
Do you see a turn now where people are more likely to involve the mental health of the patient as far as their care?
Yeah, I think it's slow. I think some professions and some professionals are better than others. I'm happy to say that the early intervention system I work in does incorporate mental health and licensed mental health counselors. And we've been able to leverage that piece, but I still think it's underutilized, underreported. Some people are not willing to say, hey, I'm struggling with this, because there's still the stigma. So slowly breaking down those walls, having those conversations, normalizing it, and making it part of the importance of a full recovery is so important to me.
Yeah, that is so true. Now, you just mentioned you teach a mental health first aid class.
Yeah.
What does that involve?
So it is a one-day class, really aimed at helping people understand, not necessarily from a diagnosis perspective, but the struggles of mental health. Where is somebody, what are some of the signs and symptoms you might see of somebody looking more disheveled or not being very focused? And how do you, as a first aider, right, just like you would perform CPR, approach that person and help them get the help they need until they can get to the right professional?
Now, is that something that you offer locally, or is this something you offer online? How do you do this?
Yeah, so that's a great question too. So Mental Health First Aid is the overseeing organization, and they are national, actually international. So I personally teach primarily for an institution here, local in Jacksonville. We do a lot of online teaching though, and there are classes offered across the country. So sometimes ours are open, depending if they fill with our local professionals or not. But they're open to anybody. You don't have to be in healthcare. You don't have to work in mental health. In fact, we encourage more people to get trained to bring that stigma down and increase awareness.
I just absolutely love that. Now, we talk about mental health. Let's talk about the importance of self care, because self care is so important
Mm,
with the mental health as well.
yes. Yeah, absolutely. That's actually one of the things we talk about in the class. So I didn't come on here to plug Mental Health First Aid, but I do think it's a pretty great program. So, yeah. So I think from both a person who's giving, right? So as a mom, as a business owner, we're constantly giving to other people. You've got to pour into yourself first. And so, self-care, I think a lot of people think about, oh, I'm going to spend a day at the spa or get my nails done. And that couldn't be farther from the truth, right? There's so many areas that are self-care. And so one thing is a busy mom and a busy business owner a couple of years ago where I found myself in a place where I wasn't engaging enough and just finding it hard to find the time for it, was practicing a 1-minute pause. So every time I got somewhere in my car, I'd shut the car off and sit for 1 minute. Sometimes I prayed, sometimes it was just breathing, sometimes it was just quiet because there was no kids yelling. But having that time to sort of just take in, how am I feeling, take a gauge on my own, gauges and how I'm doing. Am I full? Am I empty? Do I need to pour into myself more? Was super important and something I feel all of us could make time for.
That is so true. And I'm trying to look, I'm looking up the name of the book now, because there's a book that just hit on that. Remember how we were talking about certain things that
Yes.
right before we came on, she had just talked about how she had listened to one of my podcast episodes, and the Hebrews, she had just got through doing Hebrews. Well, I just got doing a study with Proverbs 31. I cannot remember the name of the book now. And I'm looking it up as we speak.
Uh-huh.
It's by John Eldridge.
Yes.
And
He talks about that. He talks about that in his book. Yes. I think I did a different study of his last summer, and that's where I kind of adopted it from, along with some other things. But yes, How to Get Your Life Back is one of the ones that he does.
I think that's the one it was. Get your life back every day. Yep. Get your life back every day.
There you go. We are on the same wavelength. Yeah. I just felt that was so helpful and something I could simply and easily incorporate every day.
Now, being a mom, how hard do you think that is for you to do?
You mean the self-care?
Yeah.
Every mom, right? Because we wear so many hats. And I feel like sometimes I meet these moms who stay at home and they're like, oh, I'm just a stay-at-home mom. I'm like, no. Like, that's just so much work. In fact, I don't think I could do it. So I applaud every mom who does that. Yeah, I think you have to be extra intentional, right? We all have to be intentional about making boundaries for ourselves. But as a mom or a business owner or just a busy woman, you have to be extra intentional because we tend to take on everybody else's problems and put everybody else first.
So, what is some advice that you can give to busy moms out there that need to take time out for self-care for their mental health?
I love this because this is actually one of the things that we do in part of my practice is taking inventory, right? So what in your life is a struggle for you? Where are you not feeling successful? Where do you feel like you need help? And then what can you do about it, right? For me personally, I'll use myself as an example. I hate cleaning. Hate it, right? That is not something that brings me joy. I like having a clean house, but cleaning is hard. So I hired somebody to help me with that. Whereas other friends of mine might use the grocery delivery. I don't mind grocery shopping, so I think it's finding that rhythm for you of what are the things that you do in your day to day that bring you joy? What are the things that maybe don't, but you have to do them? And what are the things you really hate? And how can we find a way to get some help with that and offload that so that you have more time to focus on you and your family and your faith or whatever that piece is for you, that's super important. And I think there's a lot of times we just put that all on the back burner until it explodes.
Yeah, that's true. So we have to take a brief commercial break on that, but we'll be right back. And I want to talk to you about, as a client coming to you as one of your patients, how do you initially greet them, and how do you plan out the self-care, or their plan of care, I should say. So we'll be right back after the commercial.
Awesome.
Hi, my name is Joanna, and I would like to share with you a little bit about Shores of Grace, Shores Philly. It's a ministry located in Philadelphia. The portion of Shores that I volunteer for goes into Kensington, an area greatly impacted by homelessness and addiction. And we go and we take love, food, clothing, snacks, conversation. We believe that it is a way that we can meet people right where they are and show them the love of Jesus. We have seen lives changed in big ways and in small ways, and we have built wonderful relationships with the people in the community. We have big plans, more we'd like to do, and we would appreciate any support, either through prayer or through donation. If you would like to donate, you can go to shoresofgrace.com, and in the menu, click on Donate. And we just ask that you put Philly in your donation comments. Thank you.
And we are back talking with Jenny. Now, say I'm a new mom, or I'm a mom going in and my child has all this, and we're going in your first time coming in as your patients. What's the very first thing that you do?
Yeah. Oh, I just want you to tell your story. I feel like so many times, you can fill out a history, tell me a little bit about what's been going on and why you're here from a medical standpoint. But really, it's in the details of that story that I feel like I learn the most about where my patients really need me, what we can do to help them, and where do we need to start. So yes, we're going to treat whatever PT or OT or speech need they have, or medical need they have that they're coming in, functional wellness need. But really, it's about you telling me the history of what's going on, what's most challenging for you today, what are your biggest struggles, and let's start there, because I think if we can start to make those seem smaller, then we can be more successful in changing everything.
So when the client comes in and they're talking to you, are they hesitant to first talk about what's going on, emotionally, because they're not sure where you're coming from?
Yeah, absolutely. I mean, I think that ranges. Some people are just waiting for somebody to ask them so they can get that off their chest and share it and get it out in the world. And, the more people I tell, the better somebody's going to be able to help me. But I've definitely met a whole lot more folks who are more reserved, probably have been met with some experiences in their past where they weren't heard or they weren't seen for what they were going through. I remember distinctly a mom who was really struggling with postpartum depression after her child had been in the NICU a long time, and just really stressful pregnancy, stressful delivery. And she didn't want to take the medication because she didn't like how it made her feel. She was afraid she wasn't going to take care of her baby, but she was afraid to tell anybody that because she thought they'd take her child away, which was just not even in the realm of possibility, but didn't matter because that was so real to her in the moment. So it probably took her 3 or 4 months of us meeting together to finally get to the point where she could open up about her feelings and how much fear she had around that as well.
Well, I can't even imagine, because obviously when you're a mom and you're going through that and you have a new baby and they have all the health problems, you're kind of scared about sharing your feelings and sharing what's going on, because like you said, they're so scared. People are so quick to call child protective services on you that you are just you want to ask for help, but you're afraid to reach out. What is the number one thing that a mom can do to reach out?
Yeah. I think part of this is where our agency came in, was find a tribe, right? Not everybody lives close to family anymore. Not everybody's family is supportive. Some of us grew up in really dysfunctional families, so that's not even a good resource to go back to. Find somebody who gets you. Find some people who you can rely on, who can help you, who listen to you, who love you for who you are. And I think that's so important, because I find so many moms, especially nowadays, and given the atmosphere of the last several years, they're so isolated, and they just haven't even had that opportunity to say, okay, this is normal. What I feel is normal. What I'm going through is I don't say to be expected, but is part of a process that many women go through. And so there is help and hope on the other side of that.
So how do your clients find you? Do they do a referral? Do they just look you up, or how does that happen?
Yeah, so that's a great question. I feel like we have so many cool things going on. So some of it is different. So from a therapy standpoint for kids who have special needs, a lot of times they're coming to us right from the community. They've known about us or they've heard about us from another special needs family or through a referral from their physician. But a lot of our programs really aim at that whole health, mental health, wellness component wrapped all in lifestyle medicine, as I like to call it. And so a lot of those will find me online, social media. I've been following you for a while. I'm a mom. I get this. Like you're speaking to me. And so they'll find us that way. And the cool part about that is we do a lot of our programs that way online as well. So they don't have to be local in order to work with us.
Now, you just brought up something that special needs moms, I mean, they have a lot. I mean, being a mom is tough already, but when you have a child who has a special need that maybe they're not verbal, they maybe not be able to move, that puts a whole nother area of pressure on you. How do you treat the special needs mom?
Yeah, I think one of the things we try and do is make their lives easier. So for most of our kids, we go to them. So we've taken that model from the early intervention model and we stay with them a lot of times past that for our kids who are really involved or for moms who are just really overwhelmed. We find that kids do better when they're in a familiar environment. So when they can do things at home, they can repeat them. And so they learn them quicker and their progress is better. We can interact with the whole family. And then we just take that harrowing trip of getting your child in the car, getting them to the clinic, hoping they don't have a meltdown, hoping therapy is a success, and then getting them back home, which is a marathon for them off their plate.
I mean, because obviously by the end of the day, if they had to go through so many more doctor's appointments with special needs, that
Right.
they're exhausted, and then they still got to go home and fix dinner and do laundry and clean the house, and that's just
Right. And take care of their other children, right? I mean, that's one of the big struggles we see. Realistically and unfortunately, the divorce rate is somewhere around 80% for those families. So, focusing on the other components of their family that are so important is really critical for us in order to see success in that family.
So, what made you decide to start working with just doing the whole family approach?
Yeah. So, I would say it was a combination of those aha moments we talked about earlier and pairing it with my own health. So, I went through some struggles in a high stress situation in my life about 5 or 6 years ago, and just found myself falling apart. Like, I wasn't sleeping well, I wasn't eating well. I was using some unhealthy coping strategies and just seeing it in myself and knowing like this isn't where I want to go. And then kind of doing a 180 and eating healthy and getting back into the gym and focusing on the positive and making time for myself and being okay with my emotions and realizing how quickly I got back to not just feeling healthy, but really feeling my best that I had in years and appreciating that if that happened for me, a relatively healthy young adult, how much more impactful that was for my family. So I just started incorporating sharing because I had been so successful in my own life with a lot of my families and realizing there was such a need, a gap for those families taking time for things outside of those immediate, they live in crisis, right? Those crisis situations, and they go from one crisis to the next to the next, and it wears on their health overall. So being able to incorporate that wellness piece and being able to share that beyond just my traditional therapy setting became such a passion of mine over the years.
I love one thing you just said. You said becoming okay with your emotions. That is such a big thing because a lot of people think, oh, if you cry, there's something wrong. You should
Yeah.
wrong. You should, especially cultural wise too.
Sure, absolutely. I grew up in a very stoic German family. So, my mom jokes now that it was like, you just zip that in. You didn't do that. You didn't talk about it. And so I think I've tried to be extra intentional with changing my own perspective on it and then making sure that I'm doing that with my clients as well.
So when you decided to integrate this approach with your regular physical therapy to do the wellness, how was it received to begin with?
Yeah, so I feel like for most clients, it was what they were missing, right? I find a lot especially when I started working with clients who had physical pains or physical limitations where we had never addressed these things, not just, their their eating or their sleeping or their gut health. I mean, we really get in deep. We talk about all kinds of things and detox and all of those things. Um, they might have had pain for years or they've not been able to overcome this for years. And so it was kind of a well, I'll try this because somebody else had good success with you, but I don't know that it's going to work for me. And so I've just been able to see those changes in people who have had chronic health problems that had found no relief anywhere else. So I think for the most part, the people who need me found me. There's probably a few people who think I just came to you for my, my knee pain or my child's rolled ankle, or they're not walking yet. I don't need all of this. And I'm good at reading my clients. If they're not ready for it, it's not something that it's time to implement. But for the most part, I think it's very well received to kind of think about that holistic impact of your health.
I love what you just said. You said you can read your clients. So you're not pushing it on them. If you see where they're really hesitant about sharing anything, you're not like, nope. But hopefully over time, though, have you seen it over time where at the beginning they were really hesitant? They're like, nope, not interested. And then over time, as they see you with your other patients or see you, hear about other things, are they like, okay, let's try this?
Yeah. I think I see a lot of that. I've even had people come back to me weeks and months later, coming in the first time thinking they wanted this, and then coming back 6 months later and being like, okay, well, you mentioned this too. And, I wasn't into it at the time, but tell me more. So I think that's been another nice place to see that success as I've grown.
And you mentioned earlier too about sleeping and eating. Do you look at that as well?
I do. So again, I'm kind of blending everything here, but for my clients who come to me for that wellness perspective, we really take a deep dive into their whole lifestyle. So, how are they sleeping? How are they eating? How are they exercising? Are they getting some sunlight every day? What are their relationships like? Where are their stressors? And are they even aware of them? And then how can we start to reduce those? And we dive deep into all of that. In fact, I just had a client introduce me to another friend of hers and said, she's going to ask you a lot of questions and you might even cry, but it's going to be really good for you in the long run. And I thought, I think that's a compliment. So, yeah, we dive into all of that as they're ready to talk about it.
I love that, because a lot of people, they have stuff deep down, like hidden deep, pushed down deep down. And it's not until they come to the surface that they realize, oh, wait a second, this is all of a sudden I feel free and everything's just kind of.
Yeah, absolutely. I had a client recently who, we talked a lot and I really said, I think you need to see a counselor. Like, I think there's a lot going on that you haven't dealt with, and that's okay. But you've told me this and you've told me this, and you tell me about this stress and this relationship that's, tense, and we can work through what are you doing to bring those things down. But I think there's some deep underlying things. And she came back to me after 3 or 4 sessions and she said, I'm sleeping better. My swelling was down before, but it's continued to go down. And so I think people underestimate that physiologic response to stress and psychological, conditions and stress that we're going through.
And I love also the point that you just made, that if you see someone that needs a little bit extra help, you suggest
yes,
you need to.
Yes, I can't be everything for everybody, and I don't even want to pretend to be. I know what I'm good at, and I have some great resources for the things I'm not.
So how do you manage it all? Because obviously you have your practice, you're treating the wellness of everybody else. How do you treat your wellness?
Yeah, I think that's something I have to be intentional about every week, if not even every day. So I've really honed in on my habits, and appreciating their seasons, right? There might be a couple weeks where things go to the wayside, but generally speaking, I get up every morning at 4:30 and I work out to get that out of the way, to make sure I get my exercise in and make sure I get that piece in for my global health. I usually come home and spend some time either in a Bible study or just quiet time, whatever I feel like I need that day. And then I'm just trying to be intentional throughout the day. And I think the important thing for people to appreciate is that doesn't mean I'm perfect at it, right? We've been in a busy season and there are certain aspects of that overall self-care that have slipped. I would say we're not eating as well as we usually do, but we're eating every day. We're eating as a family. And I'm okay with that for the busy season we're in. And so I think being intentional is one piece, and then being graceful with myself is another.
Let's talk about heading toward the holidays and parents that are having to deal with kids that have either special needs or they have, on top of the doctor's appointments and everything else, they also have to get involved. Not have to, but there's all that stress from the holidays. How can you kind of, okay, this is a busy season. What can I do to make it work for me?
Yeah, that is such a great question. And I feel like that's something it's a stressor. It's such a big stressor that oftentimes people don't even realize is a major stressor for them. So having, not having family close to me, I think one of the things I've gotten really good at is being able to set boundaries. I don't have to go. I have to make it intentional to go to family. And I love my family, but I think that's something I've tried to pass along to some of our families that I work with. It's okay to say, no, we're not going to be able to make it to your house this year because that just isn't going to be good around my child's nap time. Or, you know what, Joey really doesn't do well in a big crowd. And it's a lot of stress on all of us when things break down. So we're going to stay home, or we'll come over early in the day and leave before it gets really busy, or those kinds of things. So setting boundaries is really, really important and something I encourage my families to do. No is a full sentence. It's a full answer, right? No, I'm sorry, that's not going to work for me is absolutely okay. So I think that's one piece. And then, the second piece is prioritizing. There's so much this time of year. This coming Saturday, I think we have 3 events. And I was like, we're not going to make them all, right? It's just, I'm grateful to have things going on, but being able to say, you know what, thanks, we're going to set this one out maybe next year, prioritizing the ones that are important, the things that are meaningful to you and your family, and being okay with saying, I don't need to be at everything.
Yeah, I think a lot of people have that FOMO, the fear of missing out.
Yeah.
And how do we get over that?
I think for me personally, it's reflecting after the fact, right? Did I feel better because I went, or was it more stressful on me because I felt like I had to go, right? Like I was afraid I was going to miss something, and now what? Now I'm extra exhausted. I haven't slept. I haven't prioritized my own health because I was so busy doing all these other things with other people. Some people that fills their cup, and that's great. Then go. If that drains you and you're done with that, and now you're like, I need to sleep for 3 days, that wasn't the right answer for you, right? So I think a lot of that is self-reflection, and it has to be internal. And you have to feel okay with saying, this is what I need or my family needs, and that's what I'm going to do.
I know we're going all over the place, but things are popping in my head with our conversation. But it's just like a regular conversation. You mentioned that sometimes you follow your clients from when they're in the NICU onward. So let's talk about that. How the approach is different from someone that you've had since they were a little baby to a new client that's coming in.
Oh, yeah. I mean, I think in some ways that looks the same because it's constantly a reassessment for my family. So, how I'm supporting them in the NICU might look completely different than how I'm supporting them when I get home, or 6 months later when they have some other, health crises pop up or something else coming up, and that takes a priority. And so we're kind of reassessing again, and sort of like this conversation, and we go with the flow. We go with the flow of that and what's priority to them that needs to be addressed now to make them successful. So obviously, for our more traditional therapy clients, there's a plan of care and we're following that and working on that. But all those other things that we're addressing and incorporating might change as that client's needs change.
And also as the ages change as well, because we've got a whole when you hit teenage years.
Oh, yeah.
In there. So we talked about parents with kids with special needs. Let's talk about parents with kids with teenagers.
Oh, yeah. Well, I have those too, so I can talk about that. So yeah, and I appreciate, as you said that, it just reminded me actually of, I still remember the first client I treated who was moving from a child into an adolescent, and moving from, being fully dependent on the parents to really being more autonomous. And the first time I said to mom, I want him to learn how to get in his own wheelchair. Like, why are you picking him up every time? And she was like, why am I picking him up every time? I'm like, because he lets you, because you've always done it. And if you enjoy that bond and that special moment, that's great. But like, he can totally do this. So, leading from, and I think whether this is a special needs child or a typically developing child, they still have to learn autonomy, right? So we have to give them that independence, give them some control so that they can learn to make mistakes within the parameters of our household or, our parenting, right? Before they're out on their own, and then we let them make all the mistakes with nobody to help them through it. And so I think, being able to start to let go and to empower that child. Most children, whether you're talking about young kids or teenagers, do better when they have some responsibility, right? When they feel like they've contributed and there's a value. And so I don't think that changes from little on, whether that's throwing out their trash when they're 2 or helping with whatever that family chore expectation is when they get older. They might not love it in the moment, but it teaches so much about being part of the team and being valued and the value of having done it yourself and being successful.
Now, do they take more of an active role in their therapy once they become the adolescent teenage years?
Yeah, I mean, that's the goal, right? Is you don't want to live with mom forever in most cases, right? Sometimes that's not a reasonable expectation, but for my children who have that ability, I really work with the families to start turning over that responsibility to them. And sometimes that's frustrating, right? Because I mean, teenagers don't want to spend their day in therapy, and so parents want to see them continue some of these things or working on these goals, and really their goal is more about spending time with their friends and those kinds of things. And I think it's important for families to listen to their kids at that point too, and to get them to be part of the team to make that decision about, is that the right thing for them right now? Or do we really need to maybe put a little more pressure on them to be more actively involved in their therapy, because it's going to affect their long-term health and outcomes. But really, I think it has to come from the child, at least to some degree, because it doesn't matter how much I want them to do something. If they're not willing to do it, we're not going to have success.
So have you seen it where they completely went from, I'm sure you have, because most teenagers are like this, one minute they're super nice and the next minute they're like, no. And like, but have you seen it where like a complete turnaround where like before they were very amenable and able to work with you, and then all of a sudden, no, they're obstinate, or the other way around, vice versa. They were obstinate. And then once they hit teenagers, they were like, wait a second, I can do things myself. Let me start participating more.
Sure. Yeah, absolutely. I've seen both. And sometimes a swap back and forth. This week I want to do it, next week I don't care. I think it's always important, just like everything else, to incorporate the why, right? The holistic approach of what changed. Why is this so much different now than it was 6 months ago? Are you feeling stressed? Are you feeling frustrated that you don't have autonomy? Are you, mad about your situation? And that's okay. But again, we've got to acknowledge those emotions. I think it doesn't go well when it's just a forced, like, this is the expectation, versus letting that child express how and why they're feeling the way they are.
Now, does the approach as a teenager for the parents, or is it different? Can you kind of tweak it a little bit?
Sure. Yeah. I mean, you know, obviously it's a whole family dynamic. And so that's always the challenging part about working with kids, is you treat the whole family. Um, but I think, trying to advocate for that child to have their own autonomy, to have those conversations with their parent, to not step in and override those, but to help facilitate the conversation and the relationship there, because more than likely, especially for our kids who are still in therapy as teenagers, they're going to need that long term. They're going to need that parent to hear them, to help them, but also to respect them for who they are as a young adult. So I think a lot of what that turns into is more relationship building and communication skills for the two of them too.
Now, you mentioned earlier about sometimes the child comes in of divorced parents. How do
Mhm.
you get the divorced parents on the same page as far as that?
I think back when I was managing in a hospital setting lots of years ago, I took a course called Crucial Conversations. And I think those kinds of skills are still where I come back to, is that we keep the child's health and the benefit of the child at the center of all of that. So hopefully we've got two parents that, even if they can't get along together, can immensely care about their child and their child's outcomes. And so we can work together for the greater good of that piece of it. And I found that for the most part, that is really successful. I feel like most parents want to see their children be successful and can prioritize that over their own emotions. Occasionally there have, been some difficult conversations of saying, I'm sorry you two aren't getting along, or I'm sorry you feel that way. But right now we're here talking about your child, and we need to keep this focused on your child. So usually it goes pretty well when we take that approach.
Have you had one parent that was all in for the whole treatment, and one that says, no, we're just here for the therapy?
Oh, absolutely. Absolutely. I've got somebody I'm working with right now more on like a parent coaching consulting side of things. And mom was asking a lot of really great questions about like how diet might affect this and how sleep might affect this. And I think, dad's kind of perspective is, well, I ate all that stuff and I'm fine. And so, again, just coming back to, what are the goals for this child? What are the struggles right now? What are you willing to try? What should we maybe put on the back burner? And we'll come back to it. If we're not successful with the other things, then usually that parent will circle back around and say, okay, well, fine, I guess we can try it that way.
That was going to be my next question. Have you ever had a parent that once they're like, okay, this isn't working, or let's just circle back and do everything?
Yeah, absolutely. And even my adult clients, right? Sometimes they're not all in on diet changes and lifestyle management, or, I feel like a lot of times, right, when I work with moms, they're coming to me like, just I'm overweight, I have no energy, I'm frustrated, I'm tired. And their goal is really weight loss usually, but the reality is the weight is sometimes the last thing to come off. So as we start working through a lot of those other systems and challenges and all this lifestyle pieces we talked about, they might say, well, gosh, the weight hasn't changed all that much, but I sure feel lighter. I'm sleeping better. I have more energy, and now after several weeks in, the weight's starting to come off too.
Wow, I just can't even imagine. So, what is your age group that you treat? Because obviously, you said you treat kids that are in NICU, but you just said you treat adult patients as well.
Yeah. So we truly aim at helping families thrive, particularly in those younger years. So we work a lot with the 0 to 5 population of kids. Occasionally we keep, them past that age. If they've been with us a long time, they stay if they're comfortable with us and we have the means to support them. But then I work a lot with the moms too, because I think, depression and anxiety, postpartum issues are real. Prioritizing your kids' health over your own is very real. Not sleeping for years because sleep hasn't come easy for your kids is very real. And so I work a lot and have some programs just specifically designed for those women who are going through those phases of life and are now ready to say, okay, I have, denied myself this self-care. I have denied myself this opportunity for health for the sake of my family. And now it's affecting me and I'm ready to do something about it.
So, you're just local to Florida, correct?
So our functional wellness programs for moms, we do online as well. So we'll work with parents postpartum and then throughout those years as they've got more, just challenges of motherhood and life. But for our therapy services, we are just local to Florida.
I love the fact that you have the online, because a lot of moms cannot get out
Yes.
and go places because their life revolves around all the having to tote kids here and there and everywhere.
Absolutely. And even our therapy services, I mean, we are restricted to Florida because of licensure, but we'll do telehealth if that's easier. And like I said, we go to our clients a lot of the times as well.
Wow, I can't even imagine. I wish something like this was around when my girls were growing up. My girls are around older ages. They're 27 through 20. So it's hard when especially when you're a new mom and you don't know, like.
Yes. And I think it's even harder now than it was because we didn't have Instagram and, all of those things that are like, you're totally screwing your kid up. You must do it this way. No, you have to do it this way, right? It's exhausting. I mean, I have moms that come in and they're like, I'm not sleeping anyway. So I read 47 blogs on this. And now I'm really even more confused than I was when I started. And the reality is there is no manual. There is no one right answer. There are a lot of different methods. And so we just really try and meet the families where they are. Talking about their values, talking about what their biggest struggles are, and prioritizing solutions that are going to meet their needs.
What's the best advice that you can give to moms, though?
I think, probably the number one thing we see, I think moms are so busy feeling like they need to do it all and be it all that they miss out on the really enjoyable parts of their child growing up, right? I truly love that young age. My youngest is 2. He's a trip. I absolutely enjoy every moment with him. And it's okay. It's okay if my house is dirty. It's okay if, there's a melted crayon somewhere that I probably didn't find yet. Enjoy that time because they're going to be 20 and 27 before you know it. And you'll have missed out on those years worrying about all those things that are so insignificant now.
That is so hard for parents, and when they're in the thick of things, to think of to enjoy the moment. But when you look back and you're like, man, if only I had spent more time or done this or done that.
Right. And it's funny that you say that because my mom, who I feel like is very reflective, and she was a special education teacher, so I feel like she's where I get a lot of my compassion and just passion behind this from. She has just commented. She said, I remember being with you guys and being so worried about getting dinner made or cleaning the house or getting out in the garden or taking care of this, or that I didn't spend the time like you do, and sometimes it takes 10 minutes a day, right? Sitting one-on-one for 10 minutes. But when we're so connected to our phones, we're so plugged into our laptops because we work from home, it's so hard for moms sometimes to take that step back and go, what's really important right now? Where do I really need to focus my time? And so I think if I had one piece of advice for most of my parents, it's just relax and enjoy the moment.
I think that advice goes to all moms across the board, even if your kid's grown and out of the house.
That's true. I can appreciate that as well. Yeah. And plus there's a time in there in between where they don't want to spend time with you anyway. So enjoy it while they do.
That's so true. Now, you just mentioned that your mom was a special needs teacher.
Mm-hmm.
Seeing that firsthand, was that one of the, like you said, you thought that was maybe where you got that? Was that your idea? Like,
oh, I'm sure it was. So funny. I grew up in a really small town, but my mom had a lot of health problems when I was in college and going into grad school. And so I came home 2 different times on school breaks and actually ended up substitute teaching for her class while she went out on surgery. So she would give me lesson plans at night and I'd go back and teach them the next day. But I was literally in her classroom, right? Filling her shoes. And, at the time I didn't think much of it because it was just like, well, this is what I'm going to do. She needs the help. I can use the money. But I just really appreciate that that's a lot of where I got the skill set and the foundation for what I do. And then realizing, again, just how much more goes into the lives of those kids.
Yeah, that's the truth. And I applaud you for that, because a lot of people, it takes someone special to teach a special ed child or raise one. I mean, I think God picked those people just for that particular, what's the word I'm looking for?
Yeah.
Find the word, but that particular child for that parent, because they know that parent is going to be the best option for the child.
And I appreciate you saying that so much, because that's so true of all of our parents, right? When they feel like they're inadequate or they should be doing something different, or they don't have enough presents under the tree this year, or they can't XYZ. And it's like, but you were chosen to be the parent for that child because you are the best parent for that child. And so whatever you feel like your inadequacies are, they're not greater than the purpose you're serving.
That is so true. And I wish that teenagers would know that about their
I figured out my mom was right around 25 or something like that,
I think the best compliment I ever got from my daughter, and it's my oldest daughter, and the youngest one actually agrees. The middle one's, she's on the fence sometimes. But she was like, I went out to visit her this summer and I spent a couple weeks with her. It was just her and I a lot of times. Her husband was at work. And she was like, I don't think of you as my mom. I think of you as a friend who happens to be my mom.
Nice.
And I think that's what everybody wants from their children, is to be friends with them when they're old enough, so that, you're not trying to guide their lives.
Yeah, absolutely. Hopefully you poured into them when they were younger, so you can see them make those decisions now, that you can enjoy watching them grow and be the person they want to be.
Yeah, that is so true. Now, our time is almost up. Do you have one little last nugget before we talk about where people can find you at?
I think if I had one, this is from my own personal life experience and just, choosing to choose self-care and choosing to live a healthy life. It's not underestimating health. And our health is not just, are my blood values good? Am I doing okay on my weight? It is, how do I feel overall? Am I taking care of myself? Am I prioritizing my mental health? Am I getting enough sleep? Am I doing all those things to maintain my health? Because if I'm not my best as a mom, I'm not doing my best for my kids. And I want to be able to impart those changes for generations to come. So don't neglect your own health for the sake of what you feel like you need to be doing for your kids today.
That is so true, because in the long run, the kids are going to be up anchoring out of the house, and you're going to be dealing with all the health issues.
And that's it. And then I don't want to say it's too late, but it's a lot harder to overcome some of the things that have happened, as opposed to being proactive and managing those things before they become a real issue.
That is so true. Now, tell us where people can find you, Jenny.
Yeah. So our website is a great place if you want to know more about the programs we offer. That's altogetherwellness.net. And we're also on Facebook and Instagram, Altogether Wellness. And, we offer lots of education. We try and get information out to the community. So different pieces of information that help you with those young kids and knowing what to do with them and how to raise them and what things to expect from them. And then also focusing on your own health and thinking about those lifestyle factors and relationships and stresses and how they impact your life day to day. So follow us there.
And if people wanted to reach out to you after hearing this or seeing this, they just go to your website and
Yeah, there's a place there you can book a call with me so we can have a 20-minute chat and just chat about what are your goals, what are your concerns, what are your questions. We've tried to fill a gap. There's therapy services, and yes, you can get PT anywhere, but there aren't always places where you can go to get somebody to help you through the struggles you're having with your child's behavior or your own lifestyle choices that you're not quite sure if they're impacting your health, and how can we guide you through that. So we're happy to talk about all of those things.
I absolutely love that. And Jenny, I want to thank you for coming on and for sharing your journey and sharing and offering this service, because I think more doctors, physical therapists need to treat the whole patient, not just the symptoms.
Well, it's my pleasure, and thank you for letting me get the word out, because I think you're right. There's more of us that need to do better as well, and I think finding somebody who gets you and can help you on that journey is so important.
Yeah. So, guys, I will put in the show notes where you can find Jenny, as well as all the places. If you want to book a consultation call with her or whatever, I'll put that all there. And once again, Jenny, thank you so much. I think mental health is so important that we need to talk about more and more and more.
It's so true. Well, thank you for having me. I appreciate it.
Hey, guys, we will see you on the next chat from the Blog Cabin. Bye.
Bye-bye.